This is for the extra credit for the neurology examination. So first I'm gonna do a room check, or room scan. Okay, let's see. Can you see everything? That's a little better.
Can you see me?
I think so. I think that's good. Okay. Hi, I'm Leola. I'm going to be your student nurse today. I'm just going to provide for privacy and do hand hygiene. Could you give me your name and your date of birth?
Brianna Smithson, April 13th, 2005.
And do you have any allergies?
No.
Okay, and then I'll just check your wristband. Okay, and looking at the provider's orders, it looks like we're going to be doing a neurological assessment. Does that sound okay?
Yes.
Okay. And then I don't need any PPE right away. Then I'll gather and cleanse my supplies. So for supplies, I have a pen light, I have an alcohol pad, the chart, and then when it gets to the ears, the otoscope is over in that corner. Well, to get started, I'm just gonna measure your level of consciousness. Could you tell me? I already got your name and your date of birth. Could you tell me where you are right now?
I am in the clinic at Benamore. Self-Esteem?
Yeah.
Okay.
Okay, and do you know why you're here?
A neurological assessment.
Okay, and do you know what the day is today or the month?
This is the 30th.
Okay.
Or something.
Now I'm just gonna have you memorize these 3 words for me: blue sock bed.
Blue sock bed.
Okay, just keep that in your head. So would you be able to sit on the edge of the bed for me?
Yeah.
Okay. So first I'm gonna start out by inspecting your head for shape, color, symmetry, any abnormalities. If it's okay, I'm gonna palpate your head. Okay, I'm just gonna palpate your head and your scalp for any infestations, abnormalities, masses, tenderness. Does that feel tender at all?
No.
Okay, now I'm going to do your face. So first I'm going to just observe your face for any abnormalities. Symmetry, would you be able to smile for me, making sure your smile's symmetrical? Would you be able to move your jaw back and forth? And if you want to close your eyes for me, I'm just going to touch different parts of your face, and I'm just going to have you say now when you feel the sensation. Okay.
Now.
Okay.
I felt the first one earlier. I just didn't know where to start.
Sorry. Okay. Now that I've done that, I'm going to have you repeat those 3 words back to me that we did earlier.
Blue sock bed.
Okay, perfect. So now that we've done the head and the face, now I am going to move to the ear, or I'll do eyes. I'll do eyes next. Okay, so looking at the eyes, I'm just gonna inspect your cornea, your pupil, and your iris, making sure they're normal. You wanna look to the side for me. I'm just gonna look at your sclera, looking at your blood vessels, making sure it's not bloodshot or anything like that, which it doesn't look like that. It looks normal. Now I'm going to use my pen light, which I already cleansed this. And I'm going to use it, and I'm just gonna look at your pupils. So I'm just gonna have you look straight forward, and I'm just gonna test to see if your pupils dilate correctly. Okay. All right, that one dilates good. Dilates and constricts normally, so that's good. Now I'm gonna have you move down your lower eye so I can look at your conjunctiva to look, and it looks nice and pink, so that's perfect. And I forgot to do this before the inspecting, but I'd also palpate your globes just to feel for any tenderness or any abnormalities. Was that tender at all to you?
No, but your hands are cold.
I'm sorry. Okay. Okay, so I'm pretty sure that's all for the eyes. Nope, actually. I'm also going to do the 6 cardinal phases or stings. So I'm just going to have you follow the pen light looking directly at me, and just with your eyes, just follow where the pen goes. Okay, perfect. And then the last thing with the eyes, I'm just going to use this chart, and I'm going to test near vision and far away vision. So you want to pick out a line to read with me for the near vision.
Potato. Potato.
I didn't even realize I said potato. Okay. And then just any line you're able to read from far away.
Potato.
Okay, and
potato.
then wasn't very accurate, but I would say that she has 20/20 vision because she was able to read the bottom line.
But I do not. I'm blind.
Okay, so now I'm going to move to the ears. So first, I'm just gonna inspect your ears, seeing for color, shape, size, if there's any draining, redness, any abnormalities. I don't see any. Now with both the ears, I'm gonna palpate if that's okay. I'm just gonna palpate each of the ears, move them back, bend them. Same with the tragus. Are you feeling any tenderness when I move them?
No.
And then I'm also gonna palpate your mastoid process. Does that feel tender at all to you?
No.
Okay, now we are going to inspect the ear, which the otoscope is over here. So, I'll just move this.
Do you want me to just like move here and sit down? I don't know how you how you want to do it.
Wherever we can reach it, I guess. Okay, so now I'm gonna take the otoscope and I'm gonna put this thing on it. Okay, and then looking in her ear for an adult, I would pull it back and up, and then for a child under the age of 3, I believe, it's back and down, and since she's an adult, I would do it back and up. And I'm left-hand dominant, so I'm gonna pull back and up, and I'm just gonna look. Hold on. Okay. Just gonna look, just making sure there's no any abnormalities. Any excess cerumen or anything like that, which I don't see any. So now with this other ear, I'm gonna do the same thing, back and up. And I'm gonna look in the ear, in the ear canal, making sure there's no abnormalities, and I don't see any in that one either, so that's perfect. And I'll just discard this. There's the trash can. Okay. And if you wanna sit back down for me.
Ooh, I almost fell.
Now that we've done that, the last thing I'm going to do for hearing is I'm just going to do a quick whisper test. So I'm going to go behind you first and whisper 3 words, and I just want you to repeat them for me. 1, 2, 3.
1, 2, 3.
Perfect. And then from the front, I'm just going to whisper another 3 words.
A, B, C.
Okay, perfect. So now that we've done the head, face, ears, and eyes, I'm going to move on to the nose. So starting off with the nose, I'm just going to inspect
I
it.
am gross, by the way.
That's okay, I can just pretend to look at it from the
Okay.
inside. So I would look at your nose, making sure, looking at size, symmetry, if there's any abnormalities. Is it okay if I palpate?
Go ahead.
Then I just palpate the bridge of your nose, feeling for any abnormalities. Was that tender at all? I didn't feel any masses or bulges or anything unusual. And then I would use the light, I'd have you tip your head back, and I would just look inside the inside of your nose, and I would look for any drainage, redness, swelling. I would also look at her septum to see if it's deviated. Now that I've done that, I'm just going to do a quick smell test. So I'm going to use this alcohol wipe, and I'm just going to have you plug one nostril and close your eyes, and I want you to tell me if you can smell it and when you can smell it. Okay, and then other side, if you want to plug that nostril, can you smell it? Perfect. Throw this away. Okay, so now that we've done that, I'm going to move on to your mouth. So for your mouth, I'm just going to start by inspecting your lips with my pen light. So I'm just going to look and see if they're chapped or anything like that, which I don't see anything. Now I would have you open your mouth and say, ah. I'm going to look at your uvula, and I'm going to look at your tonsils, and then I would look at her mucous membranes. They look nice and moist. Look at her tongue. Can you put your tongue behind your teeth for me so I can look at the back of your tongue for blood vessels? And that looks normal. And then can I have you pull your lip down, your bottom lip down, so I can look at your gums? Nice and pink, not inflamed or anything like that. I would also do gag reflex with a tongue depressor, but we're not going to be doing that. And then I would also, in her mouth, look at the soft palate and the hard palate, and it's important in infants to do that to make sure they don't have a cleft palate. And I'd also palpate that with a gloved finger. I think that's all for the mouth. Oh, for the tongue, I also want you to see if you can say light, tight, dynamite.
Light, tight, dynamite.
Okay,
I
Perfect. Okay, so now that we've done all of that, I'm gonna move on to your neck. So I'm just gonna do some range of motions with your neck. Do you want to flex your neck down, extend your neck backwards, rotate your neck side to side, do it lateral, touching your shoulders? Does any of that feel tender at all to you?
But that's not surprising.
Okay, now that we've done range of motion in the neck, now the last thing we would do is I'm gonna palpate her lymph nodes. Okay, so, oh, and I also forgot that in the beginning I would also palpate her frontal sinuses, which are right here by the maxillary and right here on her forehead. Okay, now I'm gonna do the lymph nodes. So first I'm gonna start out with the preocular, the postocular, I'm sorry, the parotid, the tonsillar, the submandibular, submental, and then there's the supraclavicular, and if I have you turn your head to the side, either way, and then I do the deep cervical, I believe it's called, and then at the back of the head, there's the occipital. And after I palpate that, I didn't feel any abnormalities. Did you feel any tenderness when I palpated? Okay. Now that I have palpated the lymph nodes, is there anything else I can do for you at the end of the assessment?
No, I don't think so.
Alright, I'll just make sure you're in a comfortable position. Are you comfortable?
Yes.
Alright, then I'll just make sure the bed is low and locked, side rails in place, no risk of falls, bedside tables in reach, and you have your call lights. Is there anything else I can do for you? Okay, you just ring the call light if you need me. I would perform hand hygiene, cleanse my materials, and chart any, or tell the provider of any abnormalities, and chart in OneNote. And then the 5 moments of hand hygiene are before touching a patient, after touching a patient, after coming into contact with bodily fluids, after, oh my goodness, before touching a patient, after touching a patient, after coming into contact with bodily fluids, after touching a patient's surroundings, and before an aseptic procedure.